Today, in the topic of feeding of babies, we will be discussing complementary feeding. The first 1000 days are most critical, and this 1000 days is the period of pregnancy, the period of exclusive breastfeeding, that is 6 months, and then a period of complementary feeding, that is from 6 months to 2 years of age. So pregnancy period, breastfeeding period, and complementary feeding period together is 1000 days. So the health of the baby is determined by this 1000 days plus the health of adolescent girl. For example, an adolescent girl who is anemic and becomes pregnant means the baby will be born with inadequate storage of iron. Similarly, an adolescent girl who is not immunized against rubella will be giving rubella disease to the baby. And after complementary feeding, it is the toddler and child feeding which should take over. Now, regarding the first 1000 days, that is minus 9 months, that is the period of pregnancy, up to 2 years after birth. 1000 days is critical because 80% of brain growth occurs during this period of time. 50% of the height and 20% of the weight is attained by 2 years. If 80% of brain growth is achieved by 2 years, how come more than 80% of what we do actually is achieved after 2 years? So that is the hardware of brain, 80% is over by 2 years. It is like a house that is wired but not connected to fan or bulb. So we can always say 80% of the work is over. So when you connect these wires to bulb and fan, everything becomes functional. So this connection is what is going to develop after 2 years of age. So it's not that the brain growth is it's not that the brain growth gives us additional abilities beyond 2 years of age. No, it is the brain connections which gives us the additional abilities. And 50% of the height is achieved by 2 years, which means a 2-year-old child is half as tall as the parent. That is, at 4 years, the baby is almost 1 meter in height. So interventions in this period is the most effective one, and suboptimal growth in the first 1000 days is hard to reverse after 2 years of age. It is like, for example, a student is not attending 5 classes in a row, and these 5 classes are not taken by anybody else and not parents also. Then this child is not going to pick up this 5 days of class at all. So such critical gap is likely in complementary feeding because breast milk is a mixture that is prepared by nature. So there will be no fault in that. But complementary feed, we are mixing. Depending on the availability of substances, depending on our knowledge of what are the things to be mixed together, this complementary feeding is likely to have gaps. Now, why the word complementary feeding and not weaning? Weaning means at 6 months you start other foods so that you can slowly take off your breastfeed. For example, somebody is going for work. But complementary feeding means you go on breastfeeding the same way as you have been doing before 6 months, but in addition add additional food. And this additional food, that is the complementary feed, should not be started before 4 months and not later than 6 months. Exclusive breastfeeding is nutritionally adequate for about 6 months. Breast milk is having a calorie density of about 67 to 70 kilocalories per 100 ml, which is sufficient only up to about 6 months. That is, if you calculate it as 100 calories per kilogram requirement, then it will work out to be about 420, and which is supplied by about 600 ml of breast milk, which is what most mothers secrete. So beyond 6 months, breast milk alone will not be able to match or satisfy the nutritional needs. Suppose nutritional needs are not met by breast milk before 6 months of age, then we must consider another milk addition, not complementary feed. So before 6 months, if you have to add on, then it must be some milk, not some complementary feed. Now, other reasons why we start complementary feeding at 6 months is GIT and renal functions are mature enough by 4 months of age to handle substances other than milk, and motor skills of chewing has already developed, and the child has started chewing, and the child has been taking breast milk or some other milk all the time for months together. So 4 to 6 months the child has been on simply milk, and so naturally the child has got interest in other foods because he is sort of getting bored of milk alone. Then you should not have a fat phobia, because the media is all about not to have additional fat or cut down on fat, and even some countries have come out with the recommendation that babies can also have a low fat milk. But as far as India is concerned, this is not applicable. Not just because it is India, nature says so. That is, breast milk, the energy, almost 50% is supplied by fat. So beyond 6 months, when we are shifting from breast milk to other food also, then the fat cannot drastically reduce. So about 1/3 energy can still come from fat. The first few months the baby requires 100 calories per kilogram per day, and adults about 50 kilocalories per kilogram per day, which means baby will need energy dense food as compared to adult, and energy dense food is fat. So there is no question of restricting fat, and energy requirement is high during infancy as compared to adults. We should not think that the activity of adult, for example manual laborer, that consumes lot more of energy. No, suppose a sedentary worker requires 2000 kilocalories, then a very hard worker will not require 4000 or 5000. They will require something about 3000 only. So for the infrastructure building, that is what the baby is doing. For that you need a lot more of energy than activity. Protein, as we all know, it is required for muscle mass, enzymes, carrier proteins and so on. Calculated from the protein that is available in breast milk, actually the protein requirement in the first few months of life must be around 1.2 or 1.1 per kilogram per day. That is what is available in breast milk. But suppose instead of breast milk we are giving some other milk, then the protein requirement will be higher, like 1.5 or maybe a little more than that. Why? Because breast milk has got all the amino acid in the right proportion. Some other milk will not have the amino acid required by the human baby in the correct proportion. So you'll have to add some additional milk so that the amino acids can be matched to that of human milk, and whatever amino acid that is in excess can be excreted by the kidney as nitrogenous waste. Now 6 to 12 months, since we are moving away from milk, part of the calorie and protein is being supplied by source other than milk. The sources other than milk is not ideal proteins. So naturally the amount of protein required will be slightly higher than what is required when on exclusive breastfeeding. So it will be something like 1.5 per kilogram or so. And then it rapidly declines to about 1 gram per kilogram, and adult it is slightly less than 1 gram per kilogram. Variety of food is required to ensure nutrient density. Complementary foods should provide energy, protein, fat and micronutrients to fill the energy gap or the whatever nutrient gap that is there when we are shifting away from milk. So the gap is huge. For example, for a 1 or 2 year old baby, breast milk supplies only less than 50% of energy requirement, just above 50% of protein requirement, hardly any iron. So that is how the requirement goes. So you need to bridge that gap. Staples such as cereals, roots or starchy fruits that we start as complementary feed, that is good to provide energy, but adequate quality of protein is not there. For example, the cereals protein will be lacking some amino acid, the pulses will be lacking some other amino acid. So that way, complete amino acid balance will not be there. A variety of other foods should be added to the staple every day to increase the nutrient density. For example, cereal pulse mix, like we do in dosha, idli, etc. The quantity and energy density. Breast milk, the energy density is around 0.7 per ml. So when we start complementary feed, it cannot be 0.7 per ml because we are starting complementary feeding basically because this 0.7 per ml is not enough. So you have to be on the higher side of energy. So it could be minimum 0.8 and you can even go up to 1 per ml. So the energy density of complementary feed should never be less than that of breast milk. That is the point. And we should never give complementary feed in bottle because when in bottle, it is liquid, which means the energy density gets diluted. That is not the aim of complementary feeding. And the next aim of complementary feeding is to accustom child to semi-solid and then solid from totally liquid feed. So that aim also gets defeated if we give complementary feed in bottle. So the complementary feed that we are giving should be quite thick and contain energy dense foods. Basically because the baby's stomach capacity at 6 months or 8 months will be something like 200 or 250 ml. And that should provide extra energy more than what the breast milk or the milk was providing. So complementary feeding should not be given in a bottle. It should be given in a spoon, then graduate to cup. And initially when we start complementary feeding, you will think that the child is spitting. That is basically because child is used to sucking. So in sucking, middle part of the tongue goes up to compress the areola to express the milk. So that particular movement the child will be doing when offered complementary feed also. So much so what happens, whatever complementary feed is there at the tip of the tongue just comes out because that is the way the tongue moves. Middle of the tongue goes up and then the baby swallows. So whatever has gone beyond the middle of the tongue goes into the baby's stomach and whatever has not reached the middle of the tongue will just come out. So it's not spitting, it is that the baby is still learning the art of swallowing the semi-solid. And the complementary feed, as I said, must be quite thick. When you pour it from spoon, it should not flow like a liquid. It should flow like a very thick semi-solid. And the complementary feed, you will start one at a time. See, for example, rice is started now. Then for 1 to 2 weeks, you will persist with rice. And then you add next one. So that if the child is not tolerating any food, we will be able to point out, okay, this particular food item the child is not tolerating. Mixing of different cereals or mixing of cereal fruits, etc., that has got to be done after introducing these food materials individually. Usually we give about 1 to 2 weeks for the baby to accustom to one type of food. Examples of micronutrients would be iron, which is essential for hemoglobin, as we all know, and in addition is very important for cognitive development. Vitamin D and calcium for bone growth. Vitamin A for the boosting of immune system and also for regeneration of epithelium after, say, a viral infection. And of course, vitamin A is very important for the eyesight, as we all know. Iodine via thyroid hormone is extremely important for our cognitive development. And zinc is now an established treatment for diarrhea and as a preventive nutrient promoting growth, preventing infection, etc. The national data, that is NFHS4, gives an idea of the adequacy of complementary feed. Receiving adequate complementary diet 6 months to 24 months was only about 10%. All the others are deficient in one way or other. This is not much different in NFHS 5 also, where they have found that the anemia has actually gone up a little and the overweight also has gone up a little, but all the other parameters have actually improved slightly. Now, why nutritional inadequacy during the period of complementary feeding? Nutritional requirements are quite high for the baby because I said it is the infrastructure development, and traditional complementary feeds do not meet the nutritional requirement of infants in India. And also there is high rate of infection and infestations, worm infestation, and wrong beliefs. For example, the fruits are cold and should not be used during winter. That is wrong. You can use fruits at any climate. And another belief would be like pulses should not be used because for the babies it is very difficult to digest. That is also wrong. In fact, pulses are very rich in protein, very rich in fiber, very rich in various B complex vitamins, zinc, and so on. So it's extremely useful thing, and the digestion is not an issue at all because as adult we know pulses plus rice mixtures like dosha, idli and all, the digestion is actually better many a time. So that belief is also not correct. The real problems are low dietary quantity and quality, low dietary diversity, that means you persist with just rice alone or wheat alone, and low micronutrient density in the staple food. Example would be rice, and poor bioavailability of nutrients. For example, phytic acid interfering with absorption of micronutrients. And it is not proper to say that fruits we should not give in cold climate and all, because fruits are very rich in vitamin C, in addition to, say for example, certain fruits like papaya or mango, very rich in carotene, which is what gives us vitamin A. So such beliefs also contributes to nutritional inadequacy of complementary feeds in India. Another one that is prevalent, at least in some part, is people believe that males grow to a bigger size. So naturally from infancy, the males require more food as compared to females. That is also a wrong belief. Nutrient-rich food prepared hygienically and adequate in quantity and diversity, and worm infestation is taken care of, still will there be nutritional gaps. The point is, still there can be nutritional gaps. One example would be vitamin D. Whatever you do, unless you have sufficient exposure to sunlight, vitamin D will not be sufficient. Iron. Most of the complementary feeds do not have enough iron. For example, for a vegetarian diet, the source of iron would be green leafy vegetable. No child will be taking enough green leafy vegetable to have sufficient iron. So there can be nutritional gaps. So you possibly need some supplementation like iron, vitamin D, vitamin C, etc. Food fortification is another option, and fortified food is more natural than intermittent supplementation of tablets of or drops of nutrients. Another important benefit of food fortification is we can fortify food with multiple nutrients like iron, iodine, etc. This multiple fortification is what the infant food companies are doing. So in summary, more than 90% of the iron requirement must come from sources other than milk, because milk is a very poor source of iron. The usual natural food eaten by infant is poor in iron, as I already discussed. And the options are, one is an iron fortified formula if the child is on formula, fortified weaning food, food rich in iron, or food rich in iron means like jaggery, like green leafy vegetable, non-vegetarian diet, etc. Or iron supplement, because the government is giving it free of cost. So iron supplement is the most feasible option. Salt and sugar, subsequent food preference will be affected, which I'll come to. And dental caries, because sugar can predispose to dental caries, because in a very small child, proper cleaning of tooth may not be always feasible if there is a sticky sugary material inside. And gluten, the age of introduction is not related to celiac disease. So need not actually delay the introduction of complementary feed, fearing that celiac disease will come. If you have the genetic potential of celiac disease, it will come. whether you start complementary feed at 6 months or 8 months or 9 months. Allergy to egg, fish, nuts, seafood, etc. are not avoided by delayed introduction, because again it is written in your genetic material. Now, adequacy of complementary feeding. It depends on 3 parameters. Minimum dietary diversity, because single food will never be able to meet all the nutritional requirement. Minimum meal frequency, so there must be a minimum frequency of meals, and minimum acceptable quantity of meal per feed. So these 3 things will ensure the adequacy. And regarding the diversity, we can divide the food material available for complementary feeding into 6 or maybe more than that. 6 groups would be: one is cereals, that is starch providing food like cereal, roots, tubers, etc. Next is pulses. The term legume means the plant that is giving the pulse. So the seed is pulse. Pulses and nuts we can include as the second group. The third group, non-vegetarian, like meat, fish and organ meals. Egg I have taken out of non-vegetarian because egg is a complete protein, so it actually does not belong to the group of meat or fish. And milk and dairy products, it's a class on its own, so it is also taken out of this non-vegetarian diet. Fruits and vegetables, they are actually 2 classes. What fruits is providing is different from what the vegetable is providing, so they are divided into 2 groups. So food from 4 or more group means you are more or less assured that nutritionally adequate food is ensured. The guidelines for infant young child feeding, slightly modified, is given here. 6 to 9 months, start with thick porridge, that we already said. You can have a puree of cereals, or mashed ordinary food materials like mash, idli, etc. or ordinarily soft food, for example banana, a ripe banana. 2 meals per day along with breastfeeding, and start with 2 tablespoons per day, and then increase according to baby's tolerance. And as I said earlier, we will start with just one item and wait for 1 to 2 weeks before introducing another item. That is, if you start with cereal, you will wait for some time before you introduce banana. 9 to 12 months, that is near 1 year, you introduce finely chopped food in addition to mashed food. So we are graduating from mashed semi-solid to a textured food. 3 meals plus breastfeeding, and the size of one feed will be a paper cup, about 120 ml. And from 1 to 2 years, family food, but chopped a little bit for the baby to take it easily. It is like you make dosha into too many small pieces and give that way. 4 meals plus breastfeeding. 4 family feeds plus breastfeeding, and each has got a size of about 200 ml. 200 ml will be a usual glass. And if the baby is not breastfed, at least 2 milk feeds per day is essential. It is a very important thing. You should not replace milk with some other complementary feed. No, milk is not replaceable. If the child requires 2 cups of milk, give milk. If breast milk is not available, give some other milk. It is not that you will give only the most ideal thing. So that is a wrong belief, and in fact a psychological abnormality. You should not think that way. If the most ideal thing is not available, then you should have a plan B. And if plan B is not working, you should have a plan C. That's how we must plan our feeding program or anything in life. So if the most ideal thing is breast milk, but if it is not available, just go for another milk, not some other thing instead of milk. And this is the single most important cause of severe malnutrition that is occurring these days. People afraid to give some other milk when the breast milk is not available. Now, flavor and taste. Flavor and taste are slightly different. Taste, we know 4 cardinal tastes, like sweet, bitter, sour, salt. Flavor is slightly different. In Master Chef shows and all, you must have noticed that the chef who is the judge comes and smells like a dog smelling. It is basically because the flavor has got a smell element also. So smell and taste together gives the flavor. And that's why during common cold or even during our corona season, people with loss of smell actually suffer from loss of flavor also. They do not feel like eating. And how is the baby getting exposed to different flavors? Early flavor exposure provides foundation of future food preferences. And what is this early? Maternal diet during pregnancy and breastfeeding through amniotic fluid will give the flavor exposure to the baby. And breast milk, whatever the mother is taking, a tiny portion of it will be there in the breast milk and the baby gets used to it. And hence, a breast milk fed baby accepts fruits or vegetables more readily than a formula fed infant. Why? In cow's milk or in formula, what is the taste that is available is what the cow or animal is taking, which is not what we are going to take. So you are not used to vegetables that you are likely to take as the child grows. Complementary feeding also should expose the baby to different flavors early, because once late, the child gets fixed to certain tastes, certain flavors. So there is a neophobia. The child does not entertain new ones. And this is a diagrammatic representation. Yellow thing is the olfactory nerve and the receptors, and through the nose the smell goes up. And when you swallow retronasal, it comes back to the olfactory nerves again. So these together gives the flavor. That is nature's idea to make you swallow. Otherwise, you can simply chew the whatever food material you want without any restriction and then spit it out. That is not possible because that doesn't give the right flavor. For the right flavor to be appreciated, you will have to swallow it. So that is the mechanism of flavor. Flavor learning occurs in utero. Olfactory receptors and taste cells develop first trimester itself, and sucking and swallowing by the middle of second trimester. Inhalation and swallowing of amniotic fluid is already there by 6 months, 6 months of intrauterine life, which means amniotic fluid forms the first food and the fetus can detect taste and flavors. That is there in amniotic fluid. And specific reactions to differing taste stimuli can be seen even in newborns because the baby is already exposed to different tastes in utero. And like vegetables introduced early in infancy, that child is likely to accept vegetables as the child grows a little older. Our basic biology actually favors consumption of sweet and salt because that is what the body is afraid of. For example, if salt is very low, your BP goes down and hypertension can kill you. Suppose the glucose comes down, you become hypoglycemic and you can die. So when these things come, preferentially the baby appreciates that and tries to take it. So it is a very good thing, but you should not go beyond a limit. Once the baby is used to this taste, then the baby is very unlikely to come back to the normal family diet flavors. And that is my main objection to commercially available food, because it's very tasty and contains a lot of sugar and accustom baby to a taste that is unnatural, so much so the baby doesn't come back to household feeding. Taste programming studies have shown, for example, the taste of breast milk fluctuate according to the changes in maternal diet, whereas infant formula has got a fixed taste. So it doesn't fluctuate as per what the mother is taking. And if the baby is used to what the mother is taking, it is the very same thing that particular family is going to have when the baby is growing up, and hence the baby is already used to it, and that is the advantage of breast milk and the advantage of mother also taking the very same food material that the family is taking. And greater the varied experience of taste, the more likely that the baby is going to accept them when offered later on. And the important point is the mother should have been taking these vegetables right from pregnancy onwards so that the baby gets used right in utero and after birth. And any novel vegetable or novel food item introduced to the baby later, say for example beyond 1 year of age, the baby is more likely to refuse because the baby has already got fixed ideas regarding the flavors and taste he wants. So new ones, there will be neophobia and may not accept. So there are actually 3 types of eaters, babies. One is plate cleaning eaters. No issue at all, but very minority, some maybe less than 10%. Then non-eaters, they simply do not eat anything at all. Again, very minority, some 5 or 10%. Then who is the majority? They are learners and doubters. So they learn over a period of time, they doubt new ones. So to take care of this, you introduce early, right from pregnancy and during infancy earlier on, you introduce new one. That is from 6 months onwards, stepwise. And once the child is say 1 or 2 years, then they have become real doubters. New ones they will not accept. And the complementary feeding is the last milestone on the flavor bridge. Amniotic fluid, we already said, breast milk, we already said, whatever mother is taking, the tiny taste of it comes to the breast milk. And complementary feeding, we are preparing. So unless we do it in the right way, in the right combination, the flavor, what is required in later life, must be introduced in complementary feed. Otherwise, the baby will not take later on. So the points are the early exposure to a variety of usual vegetables can induce acceptance in later childhood. Repeated exposure to the same vegetable or same new substance is needed before concluding that the baby doesn't like it. Say 8 to 10 times you will have to try. Not that 10 times in a day in a row. No, 10 or 12 days. That's what is meant. Tongue thrusting, we already said, that is not spitting. It is that the baby has not yet learned how to swallow the semi-solid. Why homemade foods are better? Once you accustom the baby to homemade food, change to family pot is easier. Why? The baby is already used to whatever is the family is taking. Commercial complementary feeds are too tasty, as I said. So change to family pot is a little difficult because family diets are never as tasty as the commercially available complementary feed. Children prefers different textures to break it down self. It is true for animals even. For example, animal foods, for a dog it comes as dog biscuits, not as dog liquids. It's always biscuits or crunchy things so that the dog will be able to break it and then take it. So getting used to the texture is a very important step that we must introduce the baby into. Different textured food given in early life might facilitate baby's acceptance of more complex textures in later life. So if the solid textured food is delayed, what happens? What is wrong? The baby is still with liquid swallow technique. Food is not chewed. So suppose in such a baby you offer solid food, the food is not chewed, but like fluid, the baby tries to swallow it, which means it becomes impossible to. And there is sensory hypersensitivity. The baby is so far not used to this solid textures. So the inner cheek and pharynx are still hypersensitivity and not desensitized. So these textured food provokes gag reflex and the child may retch and even vomit. This makes parents refuse to give textured foods or solid foods again. And so solid foods are still further delayed. And the baby is now afraid to take solid foods because the baby also knows that it provokes retching. So the acceptance of textured food becomes very, very difficult in a baby in whom we have not introduced textured food earlier on. That is a very important point. We must have come across so many mothers complaining of the baby vomiting out all the solid food that is given, but takes liquid okay. Now, complementary feeding, the aim should be to gradually accustom the baby to the family food. Diet based solely on locally available unmodified ingredients are the natural choice, but could be time consuming, nutritionally inadequate. That is a very important thing. It is the most ideal thing to have homemade complementary feed. But we must, again, as I said, we must have a plan B. Suppose the mother has got to go to work and doesn't have the time to prepare all these things. I have seen like mother-in-laws insisting on continued breastfeeding beyond say 6 months or 1 year and only homemade complementary feeds. So much so the mother or the baby cannot go to work. That should not be allowed because it's a trap. So you always must have a plan B. Plan A is ideal, that is okay. But when ideal is not fitting in with our schedule, then you should be able to move on to the plan B. How can you make household methods more nutritionally complete? For example, mixing of cereal and pulses that we have already said, fermentation, roasting, soaking, malting, everything needs time. Time is the thing that you need. The other option is go for a large scale industrial production of supplements. For example, iron, vitamin D, vitamin C, etc. So adding individual medicines, individual nutrients. The other option is commercially processed food which has got multiple ingredients added into it, multiple nutrients added into it. Very good actually. But as I said, its very tasty nature is the one that makes me a little uncomfortable. So what is the way out? Suppose you have to give commercially processed fortified foods, then you can mix it with home available food and give, not just as commercially available food on its own. So much so, although the baby is getting exposed to the taste of commercially available food, it is also getting exposed to whatever is being normally served at home. So we can, over a period of time, we can reduce the quantity of commercially available food and increase the quantity of home available food and accustom the baby to the family pot. The conclusion should be complementary feeding should never be introduced before 4 months or after 6 months. The reasons we have already discussed. Flavor and texture programming must be started early in life to influence food preference of later life. And complementary feed should provide adequate energy with less volume, so you should not be afraid of fat. And complementary feeding is important for establishing good eating habit in later life. And that is why we must restrict sugar and salt, because that is what we are going to practice later on in life. So it should be the family diet, which means the other family members also should restrict these items. Then only the baby will accept it. And nutritional interventions in babies not very useful for prevention of allergic disorders, except possibly allergic dermatitis and cow's milk protein allergy. If breast milk is insufficient, for example, the baby is failing to thrive in spite of whatever you do to increase the confidence of breastfeeding mother. In that case, give another milk if the baby is less than 6 months. And if more than 6 months, whatever part of milk that is being replaced must be by another milk. That is a very important concept. Alternate milks like goat milk or buffalo milk will not prevent allergy. And children who are well nourished and taking ordinary family pot by 2 years of age is likely to be well nourished and taking normal family pot diet after 2 years also. Thank you very much.